Hey gang, here we are dissecting some questions. This is from today's lesson on client assessment, reassessment, and treatment planning. So we had a full class today, and so dissecting the questions a little separately. So here we go. All right. So during an assessment, the massage therapist instructs their client to move a part of the body without assistance. This is also known as blank. So passive range of motion, resistive range of motion, active range of motion, active assisted range of motion. Okay, so what do you think? We've just come through the client assessment program, class. A massage therapist instructs their client to move a part of the body without assistance. Let's get rid of two wrong answers. So our test taking strategy, right, is to get rid of two wrong answers. So active assisted, I don't know, is the therapist assisting? Not assisting, right? So not assisted range of motion. Resistive range. Did this question describe the massage therapist using resistance? It did not. So we can get rid of B and D because there's no resistance and there's no assistance. So you got the two left, passive or active. During an assessment, a massage therapist instructs their client to move a part of their body without assistance. This is known as, ready for it? It is active range of motion. Yes, active range of motion because the client is actively moving without assistance. Passive range of motion is when we do the ragdoll thing, right? We do the relax, let me move you. Yeah. So correct answer, letter C, active range of motion. All right, here we go. Which is the most important for a massage or bodywork practitioner to ask first when a client reports pain during a range of motion assessment? So key question, right? Key, let's look at the stem of the question to decide what are the key points. Which is the most important, so we're looking for the best answer, for the massage practitioner to ask first. So maybe we're going to ask all of these questions, but what's the best question to answer first? All right. Does it always hurt when you move? When did the pain start? Does it wake you up while sleeping? How did this happen? So what do you think is the best question to ask first? I would ask all these questions. So the client reports pain during a range of motion assessment. Ow, that hurts. So which is the most important for a massage therapist to ask? When, we're doing a range of motion test, go ahead and, we're doing a range of motion test. Ow! Oh, that hurts. Okay, so think about the condition, right? So we've just done a range of motion test and the client has reported pain. What's the best question to ask? A, does it always hurt? B, when did that pain start? C, does that wake you up while you're sleeping? D, how'd that happen? So think about this, guys and gals. We're in the middle of a range of motion assessment. We've asked the client to actively go through a range of motion and they say, ouch. What's the first question you'll ask? Does this wake you up while sleeping? Well, that's a great question, but it's not the best question to ask in this situation. You've just done a range of motion test. They said, ouch. So not, does this wake you up? Does this wake you up while you're sleeping? So I'm going to give you the other three, right? How did it happen? When did it start? Does it always hurt? I just do a range of motion test. Ow! Are you going to say, how did this happen? Well, you just made it happen. You took them through a range of motion test. Right, that's a great question to ask, but not in this scenario. All right, so that leaves us two, either A or B. Does this always hurt when you move? B. When did it start? All right, do you have your answer? Okay. The correct answer is, does it always hurt when you move? So remember, we're in a range of motion assessment. So this isn't just this is your first time you're meeting your client. The context is what's important here. So what's most important for the practitioner to ask right away? Going through a range of motion, ouch. Does it always hurt when you move? Or does it just hurt right now? Did we do something? So I hope that makes sense. Exercise during which a client does not assist the therapist is called blank. Exercise, or we could say movement, during which the client doesn't assist the therapist. So this is written in a backwards way, right? We've talked about whether or not the therapist is involved in the movement or the exercise. So exercise during which the client does not assist the therapist. Is that resisted, active, passive, or isometric? So exercise during which the client doesn't assist the therapist. What does that tell you? If they're not assisting the therapist, if that client is not helping to move their arm, the client's not helping. Come on. The client is not helping. So the answer that you're going to see in green is not the correct answer. So we've got to determine it. I'm looking ahead and I'm seeing it's not the right answer. Exercise which the client does not assist. Just leave it at that. Is that resisted, active, passive, or isometric? This question has been highlighted in green, but the answer is passive, letter C. Passive, exercise where the client doesn't assist. So if we're moving through an exercise, say they're at physical therapy, a movement is a better word than exercise there. So if you see exercise on your MBLEX, think about it in terms of movement, because prescribing an exercise is outside the scope of our practice, right? Exactly. Yes, it's outside the scope of our practice to prescribe an exercise. Say, you know what, you need to do spider up against the wall. You can show them an exercise, but we cannot instruct them to do that. All right, so the exercise during which the client doesn't assist is passive. Letter C, passive. All right, upon administrating the passive range of motion test on the neck of your client, you find a mild decrease in the rotation to the right. A mild decrease in rotation to the right. So turn your head to the right. Yeah, so if you're the massage therapist, you're turning their head to the right, and you're seeing a mild decrease in rotation. What muscle would be shortened? What muscle is shortened? All right, you ready? A, right semispinalis capitis, right levator scap, left levator scap, left trap. Oh my goodness. Ah! All right, put your thinking cap on. Do it with yourself. Rotate to the right. Okay. Which muscle would be shortened? Which muscle? So they have, so we can't, so if this is my full range of motion to the right, and I have a mild decrease in rotation, something is shortened. Something's not letting me turn my head. Think about it. Which side is it on, left or right? If I can't turn my head to the right, it's like something's pulling over here, right? You would think that this would be a muscle would be shortened because we're turning to the right and that's contracting to turn our head to the right. But if I have a restriction, it's actually something on the left. All right, what do you think? So we just eliminated 2 wrong answers. It's not on the right. So is it my levator scapula or my trap that is most likely limiting my range of motion? Got your answer? All right, mild decrease in rotation to the right. The muscle that is shortened is the left levator scap. Yes, I know. Hey, you had 50-50 chance. I told you it wasn't on the right. So it might still be confusing. So here's an image. Take a peek. I see that my video is actually interrupting this bottom part, but here's the semispinalis, and here's the levator scap. Now, we knew it wasn't the trap. Well, you may not have known it wasn't the trap, but just so you can see where semispinatus capitis is, because that can limit range of motion, but not in rotation. That's in flexion and extension. Flexion and extension, yeah. Levator scap is involved in rotation. So the passive range of motion test, I wish I could get myself out of here. All right, well, guess we were done with that one. So we'll come back to that if you need it, let me know. So assisting your client with a contraction of an antagonist to trigger the CNS to send a message to relax the agonist is a neural phenomenon called blank. Oh my gosh. I know, crazy. Okay, so think about this. You're assisting your client with a contraction of an antagonist. So let's think about bicep, tricep. We'll just pick a pair of muscles that work together. You can pick any pair of muscles, hamstring, quads, something that you can kind of think about easily so that you know which muscles work together. So we've got the antagonist and the agonist, right? They work together. Okay. So assisting your client with a contraction of the antagonist to trigger the CNS to send a message to relax the agonist is a neural phenomenon. We have talked about this. It's called blank. A, neuroplasticity. B, reciprocal inhibition. C, hypoxia. D, hyperextension. What do you think? All right. Do any of you do scuba diving? What is hypoxia? It's actually oxygen deficiency. Yeah, so it doesn't have anything to do with this question. It affects the brain, but it doesn't have to do with this question. Hyperextension? Neuroplasticity? Do you know what neuroplasticity is? If you don't, it's time to learn. Neuroplasticity is our brain's ability to regain a sense of plasticity. It has to do with aging. It has to do with age, degeneration, aging diseases of the brain. Some will say that the brain gets a little hard. And it's not really, well, I guess it is kind of hardening, but we want to keep it soft and moist, or like they call it plasticity, so that it gives. Neuroplasticity, we can regain in the brain. We can actually improve it by doing activities we don't normally do. Math, reading, exercise actually helps with neuroplasticity, but it doesn't have anything to do with muscles. All right, so A and C are out. We have 2 left. Assisting your client with the contraction of an antagonist to trigger the central nervous system, the CNS, to send a message to relax the agonist is a neural phenomenon called, all right, it's actually reciprocal inhibition. And so reciprocal inhibition is used to relax the muscle on one side of a joint while contracting the muscle on the other side. So in this case, we're using reciprocal muscle groups. I cannot contract my bicep without my brain turning off my tricep. Very helpful for cramping. We just need to be careful that we don't overdo it. All right, good for a few more? All right, hang in there. Which of the following practices should be avoided by the massage therapist? Which of these, so the stem of the question says avoided. Which of the following practices should be avoided? It means don't do it. A, scented deodorant, perfume, and cologne. B, trimming nails. C, brushing teeth after eating. D, wearing short sleeves. All right, can we get rid of 1 or 2 of those? Which is something that should be done, not avoided. So the question is, what should be avoided? But of this, what do we know we should do? Well, yeah, brush your teeth after eating if you're going to see a client. Well, just in general, I guess, but yeah, definitely brush your teeth. Trim your nails? Yeah, okay. So we know we want to do those. Do we want to avoid wearing scented deodorant, perfume, and cologne? Or do we want to avoid wearing short sleeves? Answer is yes, scented deodorant. Exactly. We want to stay away from cologne, perfumes, scented deodorant like Axe, because in the treatment room, it's a closed-in area and people can have an allergic reaction. It can be too strong. They may not like it. And if you're trying to hide body odor, take a shower, change your shirt. So, yeah, no scented deodorant, no cologne, no perfume. Sorry. All right, what does a visual assessment help to determine? What is the purpose of a visual assessment? A, determine soft tissue injuries. B, determine neurological disorders. C, determine painful movement patterns. D, determine muscular and structural symmetry and deviations. All right. What does a visual assessment help us with? See if we can eliminate 2 wrong answers. So visual assessment, help, determine. What can we determine from a visual assessment? Can we determine a soft tissue injury? Maybe. Can we determine a neurological disorder? Probably not. Can we determine painful movement patterns? We could if the person is moving. This question did not say the person was moving. It said a visual assessment. And the visual assessments that I do are normally with a person just standing there. Letter D. Does a visual assessment help determine muscular and structural symmetry and deviations? Symmetry, what does symmetry mean? Balance, right? 2 sides. Symmetry is this side what is compared to the other side. So structural symmetry and structural deviations. What's a deviation? Different, right? Yeah. All right. What does a visual assessment help us determine? We're going to take out A. No. We're going to take out C. Oh, no, we're going to take out B, right? B. So A and B are out, C and D are a possibility. Painful movement patterns, muscular and structural symmetry and deviation. Best answer? You decide. Best answer, muscular and structural symmetry and deviations. Yes, because we weren't told that the person is moving. And really a visual assessment, when we do a visual assessment, we're going to be able to see muscular imbalances. That's another word for deviation, a muscular imbalance. And any structural things. Remember we talked about how my left trap is often higher than my right. That's not symmetrical. It's not the same, right? All right, good job. Good job. Yeah, this would have taken class a lot longer. So boom, that's a wrap. Thank you so much. My name is Jodi Scholes. This is dissecting questions in practice for the Massage and Bodywork licensing exam. So thanks so much for the time and attention this afternoon, evening, or morning when you happen to be watching. I hope you enjoyed that. More of these are available at our Patreon site. I'll actually put that in the comments just in case you're not already a patron. So thanks again. My name is Jodi Scholes, and I'm your instructor for the MBLEX Review course. See you again real soon.